Good evening. I just want to thank the organizers for inviting me to be a part of this forum. And Jessica, thank you for such an amazing film. It was wonderful. I was asked, I should introduce myself, sorry. I'm Sonia Nanda. I'm a certified genetic counselor. I work at the Familial Breast Cancer Clinic at Women's College Hospital. I was asked to talk a little bit about the BRCA testing process in Ontario and what individuals should know in regards to testing. So Dr. Metcalf went over a lot of this information. So just to review, only a small proportion of all breast cancers, only about 5 to 10%, and about 15% of all ovarian cancers are actually due to BRCA1 and 2 mutations. We suspect that an individual or a family has a BRCA1 or 2 mutation when we see the following pattern. We're looking for multiple generations in a family affected with breast or ovarian cancer. We're looking for early onset of these cancers. Are the breast cancers premenopausal, usually under the age of 50? Are we seeing multiple cancers in an individual? For example, is a woman diagnosed with breast and ovarian cancer? We're also looking for rare cancers, such as male breast cancer or pancreatic cancer in the family. And we also look at ethnicity. We now know that there are common mutations that are found in certain ethnic groups, such as the Ashkenazi Jewish population or the French Canadian population. When an individual is found to have a BRCA1 or 2 mutation, we know that they're at a significantly increased risk to develop breast cancer, up to 85% lifetime risk, and up to 40% lifetime risk to develop ovarian cancer. So genetic testing in Ontario, how exactly does one get genetic testing? You have to get a referral from a physician to a genetics clinic. At the time of your appointment, you'll meet with a genetic counselor, and he or she will do several things during your appointment. We'll go over your personal or family history of breast or ovarian cancer. We'll provide personalized risk assessments. For example, what is your lifetime risk for developing breast cancer? We'll also review cancer screening and management guidelines. When should you start mammography screening, or do you qualify for yearly MRIs through the high-risk Ontario Breast Screening Program, which Shelley is going to be speaking about next? Or are you a candidate for, let's say, tamoxifen or an AI medication? We'll also determine whether or not you qualify for BRCA1 and 2 genetic testing. Currently, OHIP covers BRCA1 and 2 testing for anyone who qualifies based on 13 criteria that the province has created. Out of the 13 criteria, 10 of those criteria are specifically for individuals who have already been diagnosed with breast or ovarian cancer, and 3 are for individuals who do not have cancer, but who may have a very strong family history of breast or ovarian cancer. So what happens if you meet with your genetic counselor and you're told that you don't qualify for genetic testing through OHIP? Well, if you yourself don't qualify, but let's say you have a mother or an aunt who had breast or ovarian cancer, the genetic counselor might suggest that that relative get genetic testing. If a BRCA1 or 2 mutation is identified in that relative, then we could test you for that BRCA mutation, and OHIP will cover that testing. If you are told that you do not qualify for testing at all through OHIP, then you have a couple of pay out-of-pocket options. You can go back to your physician, your family physician, and they can organize the genetic testing for you through a commercial lab. There are several commercial laboratories that do offer BRCA1 and 2 testing, and testing is anywhere between $1,500 to $3,000, depending on which laboratory you go with. There are now private health clinics in Ontario as well as in Canada that have genetic counselors that can do pre- and post-test counseling as well as organize the genetic testing for you. But of course, all of this is paid out of pocket. I was asked to comment on direct-to-consumer testing. We see a lot about, nowadays, about $199 to test for certain genes. As far as I know, these companies do not test for BRCA1 and 2. So I'm going to switch gears a little bit. We heard a lot about, some individuals asked about their genetic test results. So what happens if you've had a BRCA 1 and 2 test and it is negative? Okay, I've been told I have a couple of minutes. So what if you have had a test and it's negative? What else can you test for? Well, in 2013, Myriad Genetics lost the patent for BRCA 1 and 2 testing, and commercial companies started to offer breast and ovarian cancer gene panels. These panels include multiple genes that we now know, if there are a mutation, can cause an individual to be at an increased risk to develop breast and ovarian cancer as well as other cancers. Currently in Ontario, there are no guidelines as to who gets a panel and who doesn't, and this is because panel testing is very expensive. There are some clinics that are now starting to offer panels. However, it's a case-by-case basis. We do review your family history, and we have to apply to the province in order to get funding. If we don't get funding, we can't do the testing. I've had some success with panels, but I will say about panels is that we're still learning, and this is because some of the results that I've gotten have been very complex. They haven't been very easy to interpret or to relay to the patient. And this is also because some of the genes on these panels are still very, very new. They've only been discovered in the past 5-6 years, and a lot of these genes don't have any clinical guidelines or surveillance guidelines. So I can say, yes, you've come back positive for a mutation, but I don't know exactly what this means for you or your family. And lastly, I want to leave you with, it's important to update your information. Genetic testing is always changing and family histories change. If you have any updated information about your family history, it's important to tell your genetic counselor, because there might be some updated or new genetic testing that we can offer to you or to your family. Thank you.